Hi everyone, my name is Destiny Watts. I'm in my second semester of the Family Nurse Practitioner program here at EKU, and I will be doing my presentation on access to healthcare in rural areas. So according to the CDC, rural Americans are at greater risk of dying from heart disease, cancer, unintentional injury, COPD, and strokes than those who live in non-rural areas. So why exactly is this? Well, unfortunately, many rural residents tend to have difficulty accessing healthcare. So ultimately, the issue here is that poor access to healthcare is leading to poor health outcomes for those who live in rural areas. And this is due to many challenges that the rural residents face that urban counterparts do not have to really worry about, such as financial barriers. The poverty rate in rural Kentucky is 20.7% compared to the urban areas of Kentucky, which are at 13.2%, according to the Rural Health Information Hub, and this is based on 2021 data. Travel distance and transportation is also an issue, and unfortunately, that only is getting worse for these residents in rural areas. According to the U.S. Government Accountability Office, this data is from 2023, between 2013 and 2020, more than 4% of rural hospitals closed, leading to residents traveling about 20 miles farther to receive services such as inpatient care and 40 miles farther for specialty services. After the closure of a rural hospital, one analysis found that it took residents in that zip code an average of 11 minutes more to get to a hospital in an ambulance following a 911 call, while residents of urban areas saw no increase in travel times. And this is a problem. So no wonder these rural residents are having worse health outcomes compared to the urban residents. Healthcare literacy is also an issue. Ethical considerations when dealing with rural residents could be that, such as the Appalachian region, for example, they exhibit characteristics such as mistrust of outsiders due to their history and authority as well. And by authority, this could also take place as healthcare providers. They may feel like the healthcare providers do not have their best interest and are kind of out to get them because they don't care about the poor people and so forth. I've seen this firsthand. Independence is also to be considered. Many, especially the elderly folk in Appalachia, they're very independent and they're very private, and they think that they can get better on their own at home and just tough it out. And I actually personally know of people who just say, I'd rather just die at home than go to the hospital. And that's probably due to mistrust, honestly. So many residents live in poverty and lack resources as well, so therefore their health is neglected. So how can we fix this? Telehealth is one of the main options that Rural Health Information Hub lists. I don't disagree. However, it is important to understand that telehealth is not the fix-all. Like, it doesn't work for everyone because many residents in Appalachia still do not have access to broadband internet. And you would definitely have to have broadband in order to get on a telehealth call these days. And also, another ethical consideration is that many people don't trust the internet, especially elderly folk in Appalachia. They do not believe in the internet. Some may not even have phones still yet. Mobile clinics, I feel like this would really be helpful for remote areas. I think that a nurse practitioner and a medical assistant could possibly start out with a van. The medical assistant could obtain some lab work, and then the nurse practitioner could just do like a health assessment on these patients that need health care but aren't able to leave their house more than just once or twice a month, if that. And then it's always important to be culturally competent and create a trusting relationship with your patients in rural areas. And then increasing community education is always a good solution, like making rounds to schools to teach the younger generations about health problems and things like that. In conclusion, incorporating telehealth, operating mobile clinics, and being culturally competent while increasing community education are all efficient ways that the family nurse practitioner can improve access to health care for those who live in rural areas. So some questions to be considered would be, with the healthcare shortage, How can providers be encouraged to practice in rural areas? Rural areas are usually pretty isolated. There's not a whole lot to do there, so many providers like to move away. So how can we encourage them to stay so that the shortage isn't so significant in rural areas? And the second question is, as a family nurse practitioner or mental health nurse practitioner, what do you think that it means to be culturally competent when dealing with patients who live in rural areas? What makes them different than dealing with those in urban areas? How can you differentiate between the two?